Hello, this is Dr. Andy Feltz, and we are going to run through a test patient on NextGen this morning. I am in the patient page of NextGen. I've already entered my inbox, which is my schedule for the day and where I will sign off at the end of the day. I've double-clicked on my patient, and I'm now ready to document. As I can see in the top left corner, the patient name appears, patient Andrea Test, female, date of birth, 67 years old. I can float my mouse over allergies, hover it over allergies, and it will list the allergies for me. And I can also float my mouse over medications. As you see here, it'll list just one medication in this test patient. Obviously, most of our patients will be many. To the right of the screen, I will see today's date, my name, and the information that the technician has started for the patient already. These blue squares are template pages or tabs, and then the other icons list medications, allergies, and there are some other icons you will see throughout the course of the training. Today's really just to get you oriented on the software. We will go more into some of the details when we do our one-on-one sessions. I'm going to open the template by either clicking on Histories or Home Page. For this, I'll start on Home Page. This loads the template. We have a series of tabs across the top. We're going to work our way from left to right on these gray tabs until we get to finalize, and then we're finished. The first tab that opens up is the Home Page. It again lists medications, so that's another way to see the medications. I'm going to go right to Histories. And in here, we're going to see the preloaded systemic conditions the patient has. I can add to this as well if I feel like there's something pertinent missing that I'm aware of by clicking Add. Maybe I ask the patient, have you ever had a stroke? Because I can see that that seems evident from their physical situation. Add to grid, and then just close it with OK. And that's going to show up now in my list of systemic conditions. There's a past ocular section, which I can use primarily for listing any pertinent surgeries that the patient has had. Again, I will click Add under past ocular. Pick an overlying category here. Maybe it's cataracts. And then click in Procedure. And it's going to give me a list of possible procedures. I can get specific, or I can say in this case I don't know. Maybe the patient just said I've had cataract surgery in maybe just the right eye. Often we don't know that, and it's not super important, so I'm going to hit cancel, save, and close. And now I'll always have this showing up in my note. I can double click it to edit it if for some reason they have the other eye done in the future. That's the Histories tab. Majority of the time, I'm simply reviewing their systemic conditions, especially, for diabetes. Next tab over is called Pretest. It does have some active area for the doctor to document as well, and that is the reason for visit. The first thing I do on this particular page is I look for when previous things have been done. Now, early on in the software, for states that are just converting, obviously most of this will be blank. We see today that my technician has dilated the patient, has already checked their pressure. What's really nice is this software will auto-populate. When any of these things are done, it'll put that date into here, and that will carry forward. So 6 months from now, if I did pachymetry today, I'd see that, yes, I haven't indeed performed that procedure, and I can look in the past to find those results. Especially helpful for photos. Photos will show up in this list from a previous date, and we can access those and quickly review them. Much easier to find photos to know if plugs have ever been done, etc. The first area where I'm going to do some real active documenting is this reason for visit. I found the best way to do that is by clicking on Additional/Manage down here. So Additional Manage, I'm going to click on that. I'll get a pop-up. This pop-up will list some conditions that we commonly see our patients for in eye care. And I can select one or several. In this case, I may select diabetic eye exam, and maybe the patient told me that their eyes were dry. I'm going to hit save and close. And I see them show up right here in reason for visit. Okay, now I'm going to click them again. This is important sequencing to generate another pop-up. I'm going to turn the one I want to add details to blue. So that's really important. I have to click it, actively click it to turn it blue. I'm going to add some details to this reason for visit now. I go down, I don't go up, I go down to the provider HPI details. I see the concern that I'm going to add details to, and then I click a few of these blue words. I actually click the word to open this pop-up. In this case, both eyes, but it could be one more than the other. Most of these I skip, but occasionally I'd use them for an acute problem. In this case, I might go to severity, and the patient may say they're stable, blood sugar, any associated symptoms. They do have some changes in vision. Associated symptoms is a multi-select box, so I could pull several things, so I have to actively close it. Pertinent negatives is another good one. Maybe they say they don't have any eye pain. You can put pertinent negatives in flashes and floaters. It allows you to add some depth to your note in a negative, in a way to put negative findings. So very helpful. And now I've built this narrative. The 67-year-old female presents for evaluation, etc., etc. I want to hit update and then close. If I wanted to type, I'm allowed to type in here as well. Whatever I desire as well. Update and close. We'll close it. And again, we will see our diabetic eye exam, but now I have this nice narrative associated HPI details to meet my requirements for a comprehensive exam. I could have added details to dry eye as well. It would have been the same process. Okay, I'm ready to move on. I see that my patient has been dilated right here in red. And if I scroll all the way to the bottom, I will see today's vision and today's pressures. What's really nice about both of these areas is if this is a patient that's been seen in NextGen previously, you will see the previous date of service and the previous vision lined up right here. Previous date of service, previous IOPs lined up right here. Very easy to track changes over time. Is it better, worse, or no different for both acuity and IOP? If for some reason you wanted to double check your IOPs, you would hit clear, taken by, so now it would list the doctor's name, enter the pressures, and hit add to grid. And you would see both instances at 6:31, technician did it, 6:47, doctor did it. I can click the next button and it will advance me to the next tab, or I could scroll to the top, and I'm here at pretest. I could simply click glasses. In glasses, the first field is lensometry. Most of these work exactly the same. I'm going to hit type. What type of lens is the patient wearing currently? And it's going to automatically proceed to the right eye spherical power. And you can see here they're all in myopic or minus power. I'm going to click in the empty space and they'll all flip to plus power. And then I grab my power, automatically takes me to cylinder right eye, automatic takes me to right eye axis. 3 ways to enter the axis. If it's an even number, I can click one of these. I can click this little keypad here, or I can actually use my keyboard and type in, as I am now, I'm typing 093 and it shows up here. Okay. My add. Now I want to proceed to the left eye. I have to actively click in the OS field. All minus. I'm going to flip it to plus. Grab my cylinder power, my axis, and my add, and I'm done with my lensometry. Similar way to fill out any of these other fields. Now, once you have something important filled out that you want to send to a final RX, from any of these, we can do this. let's say in this case, the patient's autorefraction was, +2 minus 50, and I just want to make them a little bit more, give them a little bit more plus, make them plus 150. I'm going to set as final by clicking these boxes, and this data is going to then be copied into the final glasses prescription right here. And then I just want to edit it. Click in the field, grab a different power, keep the cylinder the same. Click in the field, grab a different power, keep the cylinder the same. I'm happy with that prescription. The patient's going to be better. I think my technician has already put a PD, seg height, and frame in. I just need to make sure we're getting them a bifocal again. I'm going to click order glasses. I can add to that statement if I want to, type something in there, and then I would hit save, and that is going to send this order off to our staff in Perrysburg, Ohio, who will order the glasses. So we don't have to worry about a paper trail of who needs glasses. The software is automatically going to send that alert, and glasses will be the glasses ordering process will be started. It's actually going to generate a document that could be printed out as well, and this is basically the prescription. You can see it's appearing now under today's encounter as a document line item new glasses RX. And it's up here similar to a web browser like Chrome. It's just a different tab, so I could either click back to glasses or I can just close it like that. All right. So I'm going to click next, and that will take me to the next tab. These next two are pretty straightforward. It's very intuitive eye stuff. External exam first. There's two sections, an external and a slit lamp. I can make everything normal, or I can bring forward my last findings. This is a new patient, so we'll make everything normal. And then anything that's abnormal, I click in the field, and then I can grab from this list. In this case, let's try blepharitis, and maybe 1+. And then I'm going to shove it to the left eye with this arrow, so it shows up as a bilateral finding. I'll do the same thing for slit lamp, make everything normal. I could copy last. I'm going to make everything normal. And then again, anything that's abnormal, I can click in this field, PCIOL in good position, and maybe they still have a cataract in the left eye. All right. If I don't like any of these choices, or I don't want to spend the time to look through them, I can click in this open field and then type whatever I want. Next will take me to the internal exam. Here I have the same thing, make everything normal. I have an active selection here for CD, horizontal in the right, vertical in the right, and then if it's symmetrical, I can just click it to send it over to the left eye. In macula, it starts with the diabetic information at the top and then leads into the macular degeneration second. And there's only 2 entries, so I'm going to show you kind of maybe something that might happen. Maybe we want to put some information about diabetes in here, and make it for both eyes. So maybe we wanted to get more detail than these 2 entries would allow us. We have 2 really nice areas that I use occasionally, and that's the AMD detail if you have a macular degeneration patient, or in this case the BDR detail. I'm going to click on this and a pop-up will appear, and I can add a little bit more detail to this. Okay, you can put some macular pathology in there if you need to. And you can even type some statements as well. I'll show you how that comes into play when we get the photos also. So I'm done with my internal exam. I'm going to click Next. And now we're at Assessment and Plan. This does take a little bit of sequencing to get it just right. So just try to follow along, but it will take a little bit of practice on your test patients to feel really comfortable with it. First thing we want to get is today's assessment. We need our list of diagnoses. I can pull from my diagnosis history here. If I click a diagnosis from diagnosis history, it will appear in today's assessment. And I can pare this list down to just my own diagnoses, so I won't see the podiatrist or the dentist listed in here. And that's very helpful once you've been using the software for a while and the patients are yours. Early on, I'm going to add common assessment. This is going to pull up a list of the common diagnoses that we use on our patients on a regular basis. It's organized by anterior segment, both eyes. So these are bilateral ICD-10s. And then lens, glaucoma, retina, diabetes, and then kind of a catch-all miscellaneous option. And then there are ways to get the unilateral findings here. So let's just say they had some dry eye. And in this case, I think they had a cataract in the left. So you can see if I click that, it gives me the left eye option. And they had some mild non-P without macular edema. I get rid of these. I've got my list of diagnoses. I'm pretty happy with that. I'm going to save and close. And they show up here today. Now, technically, maybe I want diabetic eye exam to be my first diagnosis listed. So I can click Sort. And I can put them in order of what I think is most important. Save and close. And they've been reordered. When I was in common assessments, if I would have just selected them in the order of importance, that would have been another way to do it. I would have been able to skip that step. If I have something really unusual, I can do a diagnosis lookup, type in whatever I want, list will appear, and I can pick from there. Now I want to add a plan to the most pertinent diagnoses. Whether that's 1 or 4 is up to you. In this case, I will simply turn it blue with a single click, slide to the right. Under Plan, we have this My Phrases, which is very comprehensive list of common wording that we would use for the conditions we follow. And it's kind of alphabetized by category. So I'm looking for DM and mild. I will enter that into this box, and it gives me a statement. I can add to that statement as well. Etc., etc., etc. Once I have it, critical step, I need to hit Add to Grid, this red button. That's going to save that information down here at the bottom under this assessment plan summary. Okay, now we'll do another one. We'll grab cataract, slide to the right, My Phrases, and this is cataract 0 in the right, 2 in the left. I'm going to say implant in right eye is clear and stable, cataract in left eye is moderate. We will monitor for progression. Critical step again, add to grid, and I'll do that for dry eye as well. Maybe we're going to give them some artificial tears. Add to grid. And then the last step on this page is follow up. I want to put in the time interval and the reason and the type of exam I want to do next. To do that, I'm going to click in this empty field and then select my time interval, let's say 6 to 9 months. And maybe I want to do a dilated fundus exam and then add to grid. Now, at this point, I've got a nice assessment plan and follow-up schedule here. This tool is really very nice, too. You can actually look at previous ones that you have done, and it'll list your previous plans and diagnoses out. Pretty nice. Now, if I did anything extra, here's where I'm going to add that documentation, like photos or epilation, something of that nature. I'm going to click Eye Procedures right here. and I'm going to hit Bill for Fundus Photo, and it's going to give me a list of the diagnoses I already selected for the patient, and I select the one that applies to the photo. I can see my previous detail information is showing up. If I want to look at it and add something, I click it twice, and then maybe down here I could put some scattered dot and blot hemorrhages, etc. Save and close. For some of the other procedures, let's say we did an epilation of the right lower lid. It automatically puts that diagnosis in there for us. I'm going to create a document. Simply close it. Shows up over here as an eye procedure epilation. And then at the top, I want to hit Submit Procedure Billing. And save and close. Okay, now when I go to Finalize, right here, the last tab, I'll see those extra procedures showed up here. So I want to pull in what was my exam code. It's automatically going to load those from what I did previously. So in this case, we had a new comp patient. Once I click it, puts it over here in red, and I have to simply hit Submit Code. In this case, because we did a surgical procedure here, I would want to add the 25 modifier and hit Submit Code. As soon as I do this, it's going to generate a document. That document is the official medical record, and this is what we print out and leave for the facility. Basically everything we entered in the tab in a nice, very organized document. Most importantly, at the end, you'll see why we did all that work to make that grid. Here's what we leave behind for the facility. They're going to go to the bottom, and they're going to easily be able to understand what happened today. And it shows up on the right. Here's another line item under today's encounter of the final consult note. I can close it here. I can close the Finalize tab, and I'm ready to go to my inbox and grab my next patient. If I need to upload a photo before I get my next patient, I'm going to click on this images icon down here to the bottom right. And when I do that, it's going to be similar to adding, a photo to an email. You will have your Volk camera plugged in via USB, and the blue light should be on, and you would show up as a D on CSL ICO. That D drive would be where your photos are located. And they simply open up as a tab here. You close them, it asks to save them, and then this little icon will be showed up with the right eye and with left eye. Do it for each photo you want to load. Then it's easily accessible in the future if you want to view them. Okay, thanks for joining our webinar today. Again, this is just meant as an introduction, so you can kind of get your first look at the software. We will have a little bit more in-depth time when we do our personal one-on-one session, and you get to document on a few test patients. And thank you very much.